Let me take you to the consultation room. Consultation room is a place where not only the patient tells me about her symptoms, but I think it is the time that I spend with the patient developing a relationship of trust, because that is the only one important thing that will help in healing. These are my mentors, Dr. Matthew and Dr. Rupa Rangnathan. They are the big stalwarts in their field who have trained me. Here we also have the monitor where my technician can push the images and I can discuss with you what are the abnormalities and what we need to do next. We also have a CD player and a view box, because sometimes patient has already been investigated and they bring their films or CDs to read. So once I have consulted you and I know what I am looking for, what can be the underlying reason, I need to investigate you. So investigations के लिए two most important things in the area of breast are mammography and ultrasound. We have both in our facility and both are state-of-the-art equipments. Let me take to mammography room. So before we enter the mammography room, you can see here there is a changing room where you can enter and you can wear a gown, and then the lady steps inside the mammography room. This is our mammo suite. This is the state-of-the-art equipment. The mammography is done with the patient standing. The breast is kept here. This glass plate comes down, moves down, and we compress the breast from above down and also from side to side, and we take the images. Those images are pushed to my computer in the consultation room, which I can read thereafter. Sometimes what happens, even after a mammogram, if I find something suspicious, I need to do an ultrasound. So immediately after a mammography, my technician will tell you, ma'am, please step inside the ultrasound room, because Dr. Suchana will do an ultrasound and will see some specific targeted areas. This is the state-of-the-art ultrasound machine where we also have real-time elastography that really helps me in making a diagnosis, whether I need to take a sample or not. Then another equipment which helps me is this VABB equipment. This is a very beautiful equipment which helps me in taking out the lumps and lesions without giving a scar under local anesthesia. My favorite one. I'll now take you to the recovery room. After daycare procedures, you can rest here for a few hours, where we can check you for excessive bleeding or pain.